Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to welcome you to episode 56 of the Ask Dr. Angela podcast. Slowly but surely, I'm getting my voice back. I've never had a case of laryngitis that has lasted quite this long. It's killing me. But anyway, check this out. So I'm on call this weekend, and en route to the hospital, to my job, I always pass this, what's called a classic boutique. And it's not the kind of boutique that you might think it is. It's not like a boutique for purses, shoes, fantabulous clothes, etc. But it is like a store where I'm sure they sell like adult videos, adult magazines, porn, etc. And what's really kind of striking to me about this is the parking lot is always jam-packed. I was saying to my wife just the other day, I'm like, babe, this parking lot is always so packed, but I never see anyone walking in or out of this place. It's like, do they have an underground tunnel or some kind of secret entryway to gain access to this place? And here's the thing. It's probably not the usual scumbags or lowlifes that you would think frequent these kinds of places. It's probably John from next door who's married. It's probably, the mayor, chief of police, or just the most unusual suspects. And the reason that I say this is that you just really never know about people. You never know what people like, what people dislike, what people are secretly into. But anyway, every time I drive past this place, which is on a daily basis, that always strikes me as being a little bit strange. So now, having said that, let's dive right into today's question. I was emailed this question a couple of weeks ago, and quite frankly, I address this question on a daily basis. And the question is, can I take the pill if I'm over 35? And the answer to that is, hell to the yes. Absolutely. However, and that's a big however, you have to make sure that you don't have any contraindications or medical comorbidities that might prevent you from being a candidate to taking the oral contraceptive pill after the age of 35. Things that I look for in determining who is and who isn't going to be a good candidate for taking the pill over the age of 35 is, number one, are you a smoker? Because if you are a smoker, forget it. Smoking and birth control pills over the age of 35 are a huge no-go. The other thing is I'm looking for any medical comorbidities that might increase your risk for things like coronary artery disease, stroke, clotting, these kinds of things. Things that will increase your risk of cardiovascular disease are going to be things like hypertension, hypercholesterolemia or elevated cholesterol, diabetes, specifically poorly controlled diabetes. And in poorly controlled diabetics, you may want to consider like a progesterone-only type of contraception. The Mirena is a really good one for you, as well as something like Depo-Provera. Migraines with aura are another contraindication to being on the birth control pill, and I'm really hesitant to put you on that if you're over the age of 35. Hell, if you're under the age of 35 and have migraine with aura, I'm very hesitant to put you on a combination birth control pill. And whenever I say combination, I'm speaking of a birth control pill that has both an estrogen as well as a progesterone component. The other thing that we oftentimes don't even think about, but is a risk factor, is obesity or being overweight, specifically in my over 35 population. So that is also something to consider. In my obese patients, you typically do better with a progesterone-only type of contraceptive. And again, that's going to be something like an IUD, i.e. Mirena, or something else that's progesterone-only like Depo-Provera. So we've talked about being over 35 and being on a birth control pill. And again, if you meet the criteria, I think it's an excellent, excellent, excellent idea. I see so many of my patients that are perimenopausal or who are transitioning into menopause. And, again, that's characterized by many different things, whether it's hot flashes, night sweats, irregular periods, which might be skipping months at a time, having multiple periods a month, spotting in between periods, who are basically playing like Russian roulette. You're thinking, oh my gosh, my periods are irregular. I can't get pregnant. Wrong. So wrong. You need to make sure that you are using something for contraception. And one of the benefits of being on like a low dose birth control pill is it will actually help to make your transition into menopause that much easier. It'll help to regulate your periods. It will help to stave off those hot flashes and night sweats. And again, as long as you meet criteria, which we just talked about, you can use a low-dose birth control pill, again, to make your transition into menopause that much easier. So there you have it, folks. Oral contraceptive pills over the age of 35, a yes, if you meet criteria. I'd like to thank you so much for tuning in to the Ask Dr. Angela podcast. I so appreciate everyone's continued support. Please keep posting photos of yourself on both my Twitter page as well as my Facebook page wearing your bomb-ass Ask Dr. Angela t-shirts. For those of you that would like to have a topic or a question featured on the Ask Dr. Angela podcast, please go to www.askdrangela.com. That's AskDrangela.com. Click on the microphone on the right-hand side of the page and do what you do. For those of you that want to direct message me on Twitter, my Twitter handle is at Dr. Angela OBGYN, and certainly you can direct message me on Facebook at Ask Dr. Angela. I do also respond to emails if you wish to go that route, angela@askdrangela.com. If we do happen to feature your question on the podcast, someone from my team will reach out to you and we will send you one of our bomb-ass t-shirts. In closing, I would like to leave you with this. Oprah Winfrey, who was my girl, said, "The big secret in life is that there is no big secret. Whatever your goal, you can get there if you are willing to work." So let's work. Until next time, look better, feel better, be better. I can't wait to reconnect on episode 57 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon. All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.